Hello, welcome to PhysioLead. Today I'm going to explain active and passive movements of exercise therapy. So before going into the video, we have to know what is a movement. A movement is nothing but a desired action to accomplish or performed for a purpose. That is, it is a desired action which can accomplish or it is a desired action that is performed for a purpose. So movements. So in this movements we are having types of movements. What are the types of movement? That is active and passive movement. So passive movements, these are the movements that are done by the external force. Active movements are done by the patient's or the person's own muscular effect. So now in this active and passive movements, today in this video we are going to talk about the passive movements. In the upcoming videos we are going to talk about the active movements and other types of movements. So in passive movements, what is the definition? So when muscles are weak or inactive or relatively so, that is when muscles are unable to do some movement, so the movement is performed by the application of external force. This is known as passive movements. When these muscles are unable to produce some movement, an external force acts as a adjuvant. So here the external force acts as an adjuvant and it performs the movement. This type of movements are called passive movements. Another definition for this is movements within the unrestricted range of motion for a segment that is performed entirely by the external force. So the movement within the unrestricted range of motion, so there is no restriction of the motion for a segment. So it might be elbow, shoulder, etc. So this is produced entirely by the external force. There is no patient's own muscular effort. So everything is done externally. So what could be the external force? The external force could be the gravity machine on another person, that is a therapist or friend or any caretaker. It might be anyone, any other individual and other part of the patient. If the patient one side is paralyzed, so he can use another side to do the movement. So this is the definition for the passive movement. So if we go into the classification of the passive movements, it is divided into A and B. In A we get the relaxed passive movement. In this video we are mostly gonna deal with this relaxed passive movements and accessory passive movements and passive manual mobilization techniques. What is this passive manual mobilization techniques? In this we are having mobilization of the joints, manipulation of the joints and controlled sustained stretching for the tightened structures. What are the tightened structures? Obviously they will be the soft tissues. It might be the muscle or it might be the tendon, so or it might be even the capsules. So here these three are separate topics which we are going to deal in the upcoming videos. So today I'm going to explain you about the relaxed passive movements and accessory passive movements. So relaxed passive movement. Relaxed passive movement is nothing but the movement that is smooth, rhythmical and accurate anatomical movement which is performed by the therapist within the pain limited range. If it is the smooth, rhythmical and accurate movements, they are the anatomical movements. That is nothing but flexion, extension. They are normal movements which are done by the therapist within the pain limited range. If the patient is getting the pain, the therapist should stop the procedure. So it is a smooth rhythmical movements and these movements should be done in the same range and the therapist has to do these movements, no? So the therapist should have a vague knowledge about the anatomical movements, the structures, the joint movement, the joint play, etc. So now patient must be placed in a well supported position, and this well supported position will allow the therapist to do the complete range of motion, and the therapist should support the limb of the patient and move the patient limb when the patient is in relaxed position. This technique can be restricted for several joints or it can be only for the single joint, and this technique can be performed for a single joint or it can be performed by multiple joints at a single time. And this technique is carried out when the patient is unable to perform active movements. That is, when the patient is having muscle weakness, when he's having paralysis, he can't do a movement. So that in that time, at that situation, the therapist will do it passively. So coming to the principles, first one is relaxation. So coming to relaxation, in relaxation, the patient should be in relaxed position. He should not be in a inconvenient position. If he is in inconvenient position, there will be some tension in the muscles developed. So this tension will not make the therapist to perform the entire movement. And so to ensure the relaxation, the patient should be before starting the procedure only, we have to tell the patient what are we gonna do. So we have to explain the patient what are we going to do to the patient. So this will make the patient mentally relaxed, and the position also should be in a relaxed position, and the environment also should be in a relaxed position. When there is no tension in the muscles, the complete range of motion can be achieved. And also, when coming to the relaxation, the therapist position also plays an important role. That is, the therapist should attain a walk standing or straight standing position to do the movement. Second one is fixation. Fixation is nothing but to make the movement localized, that is to limit the movement to a single joint. We stabilize the above joint, that is the proximal joint. In case, suppose if we are moving the elbow joint, we have to stabilize the shoulder joint. The proximal joint should be stabilized or fixed, so that the movement is localized and the movement is accurate, and also to prevent the trick movements. Third one is support. So the full support should be given to the patient's arm or patient's part that is gonna the therapist is gonna move. So complete support has to be given to the therapy. Complete support is to be given to the patient's part which is gonna move. So if the patient is heavy, so we have to use slings or pulleys to ensure the support. Fourth one is traction. A longitudinal traction has to be given to the joint that has to be moved, so that this longitudinal traction decreases the intra-articular pressure, intra-articular friction. If the friction is reduced, the movement is so free and it is so accurate. So traction will ensure the adhesion breakage also. So it is also helpful in the breakage of the adhesion. Therefore, a free relaxed passive movement is performed. Coming to the range is nothing but the movement which is done in the anatomical range. So it should be a pain-free range. If the patient is getting the pain, I have said you before, even if the patient is getting the pain, the movement has to be stopped. So the movement has to be performed in a pain limited range, and if it is a stiff joint, the anatomical movement range should not be exceeded. And also, the movement should be forceful enough to break the adhesions and to maintain the muscle property. Now, speed and duration. Speed, so the speed should be rhythmical, smooth, and at the same speed should be maintained throughout the movement. So they should not be in the starting you have done it speedily, fastly, and then in the middle you reduce the speed. It should not be like that. It should be a smooth, rhythmical, and same speed should be maintained. Also, there should not be any jerky movements, and the movement can be performed n number of times according to the situation or according to the condition of the patient. That is a duration. How many times you are performing the movement is a duration. So it will be depending entirely on the therapist and the patient's condition. Last one comes the sequence is nothing but how we are proceeding to the treatment. That is, you are coming from the proximal to distal or from the distal to proximal. So in cases of flaccid conditions, that is a weak, there is no tone in the conditions, hypotonia. In hypotonic conditions, we do the movements from the proximal to distal, that is from the above to the below. So, example, shoulder joint should be first, for shoulder joint movement should be done first, then elbow, then to the wrist and the fingers. So that is in the flaccid condition. If it is a spastic condition, or if you have supposed to drain the venous return or lymphatic drainage or edema, it should be from the distal to the proximal. So this is the sequence. Now we are going to see the indications of the passive movements. So what are the indications? The patient, to whom are we doing this passive movements? Patient who cannot perform the active movement, patient who cannot perform the full range of movement, and if it is a prolonged bedridden patient, we do passive movements so that we can prevent the DVT, that is deep vein thrombosis, and to maintain the muscle property, to increase the venous retain or venous drainage and lymphatic drainage. So these both will ensure the prevention of edema or any tumors. So to break the adhesion formation, so that the joint ROM can be increased. So adhesions, if any adhesions are there, so that adhesions also can be broken with this passive movements. Unconscious patient, for relaxation, this passive movements are very good for the relaxation in the further movement, further videos, when we are going to tell about the stretching, mobilization, we always start with a passive movement so that the patient does not get tensed. So patient get adapts to the therapist and then ensures the relaxation. Edematous limb assess the healing process following the injury or surgery. So immediately after surgery we do the passive movements so that there is no surgery related complications, and ensures the more blood and nutrients to the organ or the part where we have done the treatment or surgery. So there the healing process will be fast. And then determines the joint stability to determine the soft tissue elasticity. So before starting any treatment, we just do a passive movement so that we can know what is the joint status and what is the soft tissue status. So to examine also we can do the passive movements. Reduce or inhibit the pain to teach the active home program. What is this active home program? Is nothing but, so after the treatment is over, we tell the patients to do some movements or to do some exercises at home. So to teach these exercises we do passive movements, passively we teach them. Next, when the therapist is preparing the patient for the stretching, so before giving any stretching technique, we have to do a passive movement. And then to maintain the mechanical elasticity of the muscle, enhances the synovial movement for the cartilage nutrition and assists circulation, minimize the contracture formation. Now we are going to see the contraindications. What are the contraindications? Means that the what are the conditions that are not indicated for the passive movements, that are recent fractures, recent dislocations, DVTs. So actually I said you in indications to prevent the DVTs. If the patient is having DVT, we are not supposed to do the passive movements. To prevent, we are supposed to do the passive movements. If the patient is having DVT, we are not supposed to do the passive movements. Malignant tumors, psoriatic arthritis, recent injury or inflammation, fleal joints. In case of fleal joints, the therapist should have more consciousness. That means he should take more care when he's dealing with the fleal joints. And hemarthrosis, early burns, hemophilic joints, patient with the POP, or that is plaster of Paris, or external appliances. What are the effects and uses? The passive movements can increase the ROM, maintain the muscle property, break the adhesions, prevent DVT, deep vein thrombosis, induce relaxation, and teaches the movements for the home program. And also, I have not included a point here that it also increases the venous and lymphatic drainage. So what are the limitations? So these passive movements, the true passive movements cannot be performed, or it may be difficult to obtain when the muscle is innervated and it is conscious. So in case of paralysis, etc., in those cases the muscle is not innervated, and so in that cases it will be helpful. But if the patient is having an innervated muscle and if it is conscious, we can't obtain a true passive movement. And also this passive movement cannot prevent the muscular atrophy, and it also cannot increase the strength and endurance of a patient's muscle, and it also cannot assist the circulation in such a way that it like the circulation, it cannot be as we can't get the circulation that we get in the active movements. If we are doing an active movement, the circulation that we get in that active movement, we can't get in the same circulation in the passive movement. That is one more limitation. And what are the basic rules for doing this passive movement is, so first thing is the parts that are not to be moved, that is the proximal joints, so they should be supported adequately, and the parts that are moved, that are to be moved, should be grasped comfortably. They should not be, you should not press them, or you should not just like loosely hold them. You should have a comfortable grip. And then the sequence should be always from the distal to proximal, and I've said you the sequence. So if it is a flaccid, it should be from proximal to distal, and if it's spastic or venous drainage, it should be from distal to proximal. So usually we use distal to proximal sequence. And then the extremities, all the extremities, skin side should be raised to prevent the dragging. So if we are doing a movement, the skin will be dragged, so that so we should see the skin slide also. Then the grasp should be near to the joint. So if we are doing for a shoulder elbow joint, we should be holding near the brachioradialis area, that is near to the joint. So this is all about your passive movements. In the next video I'll be telling you about the accessory passive movements and also the other leftover movements. So if you want any notes, please comment down. Thank you. Like, share and subscribe to my channel.